Which of the following factors is most likely contributing to the development of this patient's condition? 25-year-old woman presents with an itchy red rash on her eyelids, nasolabial folds, and behind her ears. She's tried various moisturizers, but the rash persists. On examination, there are erythematous patches with yellow scalding in the affected areas. Which of the following factors is most likely contributing? Okay. I think this is one of those dermatitis. There's like a one that's around the scalp. If this is no, this is not really around the scalp. Various moisturizers that persist, but the yellow scaling in the affected areas. I'm just remembering something with that on, especially on the face. Her eyelids, nasal behind her ears. So I don't think this is like an SLE rash, so I'd get rid of autoimmune process.
Okay.
I don't think it's like a rosacea with or drug related, so excessive sun exposure. I don't think so. Um, Allergic reaction isn't the worst, but for some reason the Malaysia yeast overgrowth is that was my gut reaction. I don't see why I would change it. I know it's
Okay.
not like the classic tinea versicolor, but it's something is telling me it's related to Malaysia. I don't know why.
Final answer.
Yes.
Okay. So let's see. So good. So
There's like a
itchy
picture that came to
reaction.
my head. Oh, seborrheic dermatitis. Okay.
Yep. Consistent with seborrheic dermatitis, right? Common skin thought to be related of overgrowth of Malaysia yeast, which is part of the
Mhm.
normal skin flora. Yeast overgrowth leads to inflammation and scaling in the areas with a high concentration of sebaceous glands. Okay.
Okay, that makes
Allergic
sense.
reaction, pruritus, erythema, edema, right? Usually is not typical for an allergic reaction. Yellow scaling is more for seborrheic dermatitis. It doesn't really have yellow scaling, right? Autoimmune processes, right, that you can think of that has scaling,
Oh,
psoriasis or
psoriasis. Yeah,
lupus. Yeah.
psoriasis. Okay.
But in the locations, it doesn't really fit with
Right,
psoriasis.
that would be like the extensors,
Exactly.
psoriasis. Yeah.
Exactly. Excessive sun exposure, right? Photosensitivity reaction.
Hmm.
It's kind of a weird because if you think about where its location, it's like it's behind the ears, right? So
I
that's
mean,
really
if it was just face, you could make an argument for like rosacea. I know that they ask that a lot, like sun
hmm
exposure or heat, or even like hot beverages or something can aggravate
sure.
rosacea, but it's
Alcohol,
not,
things like
or
that.
alcohol. Yep, but it doesn't really fit.
Yeah. And then viral infections, right? I mean, you get the with measles and chickenpox and things, but it doesn't fit here. So
Okay.
good.